Hello everyone, welcome back to my channel. This session is actually a continuation of the topic knee joint. So those who are watching this, please do see the session of knee joint part 1 so that you will get a continuation. So in this session I am planning to talk about the articular surface of tibia. So superior surface of the condylar articular surface of tibia, which is articulating with the condyles of femur. So when you look, this will be the superior aspect. If this is the tibia, as you look from above, this is how you see. So you can see the anterior aspect is this and posterior aspect is this. And we have two important structures in the superior surface of tibia, that is the medial meniscus and the lateral meniscus. They are fibrocartilaginous discs which are seen on the superior surface of tibia, articular surface of tibia. And that is how the knee joint is divided into the region which is in contact with the tibia as meniscotibial compartment and the region which is in contact with the femur as meniscofemoral compartment. Menisci, the attachment of the tibia, and this region in the middle is known as the intercondylar region, because these are the two condyles of tibia on which you have the medial meniscus and lateral meniscus seated, and the region between is known as the intercondylar region. So in this session I will be talking about the attachments seen in the intercondylar region as well. So let's see one by one. First we will talk about the medial meniscus. Medial meniscus, if you see, you can see that it is just C-shaped, that is just C-shaped. Meniscus means crescent, so something which is crescent shaped, that is why it is called meniscus. So medial meniscus is C-shaped, whereas when you compare this with the lateral meniscus is somewhat ovoid or circular and it occupies almost 4/5 of a circle, whereas this is just a C, whereas this is just an ovoid which occupies almost 4/5 of a circle. Now what are the other important structures? So the important structure attached to the medial meniscus is the medial collateral ligament. So we have the medial collateral ligament medially and the lateral collateral ligament laterally. So medial meniscus is attached to the medial collateral ligament. So the difference between medial and lateral meniscus is lateral meniscus is not attached to the lateral collateral ligament, and that is said to be one of the reasons why you get medial meniscal tear more common. Why? Because if you have medial collateral ligament tear, obviously since it is attached to the medial meniscus, it will also be torn. So it goes hand in hand, medial meniscal tear and medial collateral ligament. The reason is both of them are attached. Whereas when you talk about the lateral meniscus is not attached to the lateral collateral ligament, but it is, the posterior aspect is attached to some of the fibers of the popliteus which will actually push away the horn of the lateral meniscus during the movements of the knee joint, and it is actually helping to prevent the tear for the lateral meniscus. So that important point you have to remember. That is the reason why you get medial meniscus more prone for injury and lateral meniscus less prone for injury. Now what are the functions of the menisci? When you see or when you get the meniscus on the superior surface of the articular surface of tibia, it increases the concavity so that the femoral condyles can articulate smoothly. The next one is it lubricates. It is actually acting as a swab which is kept in between the two bones, that is the femur and tibia. So it actually helps to lubricate the joint. And the next one is it is acting as a shock absorber, because you know the whole weight of the body is passing through the knee joint to the foot. So these menisci will actually act as a shock absorber between the femur and tibia during the transmission of their weight. Now we will move on to the intercondylar region of tibia from anterior to posterior. First I will say a code for you all to remember. The code is Medical College Lucknow Medical College. So this is the code which we usually try to use to remember the structures, how they are attached on the intercondylar region. So let's try to expand Medical College Lucknow Medical College. So let's try to expand this. First is M. So what is this M? Here we have already mentioned this as medial meniscus. So this is the anterior horn of the medial meniscus. So that is the first letter M. Then what is this? That is actually C. Medical college. The second letter C for college is C. This is anterior cruciate ligament. So one point I would like to add here is the anterior cruciate ligament and posterior cruciate ligament, they are actually in the form of an X which lies between the femur and tibia. So this is named anterior and posterior according to its position in the intercondylar region. So since it is lying in the anterior aspect, you call it as anterior cruciate. Since it is attached to the posterior aspect, this point will you call it as posterior cruciate ligament. So the second attachment in the intercondylar region is anterior cruciate ligament. The third one is Medical College Lucknow, L. L stands for, this is the lateral meniscus. So this is again the anterior horn of lateral meniscus. Then again you have the Lucknow Medical College. So L4 again, it is the lateral meniscus, but this time it is the posterior horn of the lateral meniscus. The next letter is Lucknow Medical College. M stands for again medial meniscus, but this time it is the posterior horn of the medial meniscus, and ultimately you have the C, that is the cruciate ligament. So which cruciate ligament you get on the posterior aspect? It is the posterior cruciate ligament. So this is how you get the structures arranged from anterior to posterior. Anterior horn of medial meniscus, you have anterior cruciate ligament, anterior horn of lateral meniscus, posterior horn of lateral meniscus, posterior horn of medial meniscus, and posterior cruciate ligament. So this is very important. You will get it during Viva, during spotters. When you get tibia, you will be asked how are the structures attached, theory, whatever. And these are very important ligaments as well. Now, which are some of the important ligaments seen attached to the menisci? So the anterior horns of the menisci are attached through the transverse ligament. So the transverse ligament connects the anterior horns of medial and lateral menisci. Then laterally, medially and laterally, you can see the menisci is attached to the tibial condyle. So what do you call this ligament? This is known as coronary ligament. So coronary ligaments connect the menisci to the tibial condyles. So medial menisci and lateral menisci are connected to the tibial condyles through coronary ligaments. Now coming to the posterior horn of lateral meniscus, not medial, it is lateral meniscus. You have two sets of fibers. Can you see? Which connects this posterior horn to the femur. So posterior horn of lateral meniscus to femur, you call it as meniscofemoral ligament. Meniscofemoral means posterior horn of lateral meniscus to femur. And it is named anterior and posterior based on the posterior cruciate ligament. So the fibers, if this is the posterior cruciate ligament, the fibers running anterior to the posterior cruciate ligament and getting attached to the femur, you call it as anterior meniscofemoral. The fibers running posterior to the posterior cruciate ligament and then to the femur, you call it as posterior meniscofemoral ligament. And it is again given another name. Anterior meniscofemoral ligament is known as ligament of Humphrey, and posterior meniscofemoral ligament is known as ligament of Risberg. This is actually more important for the postgraduates. Undergraduates, you have to know there is a set of ligaments which connects the posterior horn of lateral meniscus with the femur, that is meniscofemoral ligament. And how they are named anterior and posterior, it is based on the posterior cruciate ligament. And one more important landmark is the tendon of popliteus, which is grooving the posterior aspect of the lateral condyle of tibia. Okay, so some of the fibers of the popliteus are seen attached to the posterior horn of the lateral meniscus, and that is said to actually pull out the lateral meniscus during the movement, and this helps the wear and tear of lateral meniscus compared to the medial meniscus. So this is about the attachments, the important attachments of the menisci and what the functions of the menisci. And now you will be wondering how this menisci is getting its nutrition. So nutrition, when we talk about, we can talk about the nutrition from the peripheral aspect and from the central aspect. Peripheral aspect is said to be vascular because it is getting its nutrition through capsular arteries, the sub-arteries seen in the capsule of the knee joint. But the medial aspect is said to be avascular. That means there is no blood supply, direct blood supply. So what about the nutrition of the medial aspect? it is getting through the synovial fluid. That is how the menisci is getting its nutrition. Lateral is lateral part, the outer periphery is vascular through capsular arteries, and the medial part is avascular, and it is getting its nutrition through the synovial fluid. And it is said menisci has got a capacity to regrow, but for that you need to scoop out the entire menisci so that you will get a new set of menisci regenerated at that region. That is how it works. So this is about the menisci, the intercondylar region of tibia, and the various important attachments. We will be talking about the injuries and functions, more about its functions in the coming sessions. Please do continue to watch. Thank you.